Hi, my name's Kelly. I'm a CBT therapist and forensic psychologist. Today I want to explore with you what it means to be trauma-informed. So I'm thinking about trauma-informed practice. So trauma-informed has become somewhat of a buzzword recently, as it's increasingly being spoken about in policies, and positively it's been adopted in more and more practice. Trauma-informed focuses on reducing the negative impact of trauma experiences and supporting mental health and physical health outcomes. And although there has been an increase in services and individuals adopting this way of working, continues to be a lack of consensus on how trauma-informed practice can be or is defined. So what is known as there are key principles and how those key principles can be built into services and systems. And although there isn't one agreed definition of trauma-informed practice, we know that it incorporates the realizations that trauma can affect individuals, groups, and communities. And trauma-informed practice is an approach to health and care interventions which is grounded in the understanding that exposure to trauma can impact upon an individual's neurological, biological, psychological, and social development. So, with that, trauma-informed practice aims to increase practitioners' awareness of how trauma can negatively impact upon an individual, group, or communities, and their ability to feel safe, but also to be able to develop trusting relationships with services or the professionals that work within that service. Trauma-informed practice seemingly borrows some of the same thinking from the power, threat, meaning framework. So what I mean by that is that trauma-informed practice acknowledges the need to see beyond an individual's presenting behaviours and to ask the question of what does this person need rather than what is wrong with this person. And with that, trauma-informed practice seeks to avoid re-traumatisation, which is the re-experiencing of thoughts, of feelings, of sensations experienced at the time of a traumatic event or circumstance that's happened to them in their life. And re-traumatisation is generally triggered by reminders of that previous trauma or that event, which may or not be potentially traumatic in of itself. And then the purpose of a trauma-informed practice, it isn't to treat the trauma-related difficulties itself, because that's the role of trauma specialist services and practitioners. Instead, trauma-informed practice seeks to address the barriers that people affected by trauma can experience when accessing health or other sorts of services. So as I said, we do know about the principles of trauma-informed, so I want to break them down. So there are 6 key principles of trauma-informed practice. So you have safety, trust, choice, collaboration, empowerment, and cultural consideration. So we're going to go through each of those different key principles. So firstly, safety. Safety is about the physical, the psychological, the emotional safety of service users and staff. And this is prioritised by people knowing that they are safe or asking what they need to be able to feel safe. There is a reasonable freedom from threat or harm within the service that they're in, and that people would make attempts to prevent re-traumatisation, and then being able to put policies, practices and safeguarding arrangements in place so people feel safe. Then we have trustworthiness. So trustworthiness is where the transparency exists in an organisation's policies and procedures with the objective of building trust among staff, service users and the wider community. And this is done by the organisation and the staff explaining why they are doing something and what they are doing. And the organisation and staff doing what they will say they will do, so remaining consistent. And within that, the expectations are made clear, and the organisation and staff are not over-promising things that they can't follow through on. Then we have choice. So choice is about service users being supported in shared decision making, so collaborative choices and goal setting to determine the plan of action that is needed to be able for the individual to heal and move forward. And this is done by ensuring that service users and staff have a voice in the decision making process of the organisation or the services themselves. Then listening to the needs and the wishes of the service users and the staff involved. Being able to explain choices clearly and as transparently as possible. Acknowledging that people who have experienced or are experiencing trauma may feel a lack of safety or control over the course of their life, which can then cause difficulties in developing trusting relationships with others. Then collaboration. So collaboration is the value of staff and service users' experience is recognised in overcoming challenges and improving the system as a whole. And then this is done by using formal or informal peer support, sometimes mutual self-help. The organisation asking service users and staff what they need and collaboratively considering how these needs can be met. Then focusing on working alongside and actively involving service users in the delivery of the services that they are part of. Then we have empowerment. So empowerment means that kind of efforts are made to share power and give service users and staff a strong voice in decision making at both the individual and the organisational level. This can be done by validating feelings and concerns of both the staff and service users. Then being able to listen to what a person wants and what a person needs. Supporting people to make decisions and take action. And then being able to acknowledge that people who have experienced or are experiencing trauma may feel sometimes powerless to control what's happened to them, and they may feel isolated by their experiences and have feelings sometimes of low self-worth. Cultural consideration. So to move past cultural stereotypes and biases based on, for example, gender, sexual orientation, age, religion, disability, geography, race, or ethnicity. And again, this is done by offering access to gender responsive services, but also leveraging the healing value of traditional cultural connections. Incorporating policies and protocols and processes that are responsive to the needs of individuals served. And they are the 6 key principles, and that is kind of understanding about how trauma-informed practice can be used and should be used in a variety of practices. I hope you found that helpful. Please like and subscribe and check out my other videos. Thank you.